Elderly Caregiving 1, presented by Group 5, Professor Mrs. May Rogero Bacason. Our goal is we will gain knowledge and comprehension of medical terminology, aging, and strategies for caring of the urinary and reproductive system.
Hi, my name is Tricia Kurt Sadbun and I am from St. Agatha Apalit. I will be discussing or I will be reporting about the 20 medical terms about urinary system. Nephron, the function unit of kidney responsible for filtering blood and forming urine. Glomerulus, a network of capillaries at the beginning and nephron in the kidney, where waste products are filtered from the body. Renal tubule, the part of a nephron where filtered fluid passes through and is further processed into urine. Ureter, a tube that carries urine from the kidney to the bladder. Bladder, an organ that stores urine until it expelled from the body. Urethra, the tube that carries urine from the bladder out of the body. Kidney stones, hard deposit formed in the kidney from mineral and salts. Urinary tract infection, or also known as the UTI, an infection in any part of the urinary system, often caused by bacteria. Cystitis, inflammation of the bladder, often due to a urinary tract infection. Pyelonephritis, a type of urinary tract infection that involves the kidney. Renal failure, a condition where the kidney lose the ability to filter waste and balance fluid. Hematuria, presence of blood in urine. Proteinuria, presence of abnormal amount of protein in urine. Polynuria, excessive of abnormally large production of passage of urine. Hydronephrosis, swelling of a kidney due to build up urine. Renal pelvis, the central part of the kidney where urine collects before moving to ureter. Renal calculi, another term for kidney stones. Urethral structure, a narrowing of urethra, often leading to reduced urine flow. Urinary retention, the inability to completely or partially empty the bladder. Incontinence, the loss of bladder control resulting to involuntary urination.
Hi, I am Francesca Cunanan and I'm here to discuss the aging process of the urinary system. The aging process affects the urinary system in various ways, often leading to changes in structure and function. Here are some key aspects of how aging impacts the urinary system. Number 1. Decreased bladder capacity. With age, the bladder may lose some of elasticity and ability to stretch, resulting in a reduced capacity to hold the urine. This can lead more frequent urination, especially during the night. Number 2. Weakened bladder muscle. The muscle of the bladder may weaken over time, leading to decrease the bladder control and increase the urinary tract incontinence. Number 3. Increased residual urine. Aging can impair the ability of the bladder empty completely, resulting in a higher volume and residual urine. This can increase the risk of urinary tract infection or UTI and bladder stones. Decreased kidney function. The kidneys may undergo structural changes with age, including reduction in number of functional nephrons, the filtering units of the kidney. This can lead to a decrease in a kidney function and reduced ability to filter waste and maintain electrolyte balance. Changes in urinary sphincter function. The urinary sphincter muscle, which controls the flow of the urinary fluid from the bladder, may weaken with the age, contributing the urinary incontinence and difficulties with late urination. Increased risk of urinary tract infection. Changes in the urinary tract such as decreased bladder, emptying and weakened immune function can make older adults more susceptible to urinary tract infection. Higher prevalence of urinary tract obstruction. Age-related changes such as prostate enlargement in men and pelvic organ in women can increase the risk of urinary tract obstruction, which may lead to urinary retention and other urinary problems. Decreased sensation of thirst. Aging can reduce the sensation of thirst, leading to dehydration, which can affect the kidney function and urinary output. Changes in renal blood flow. Blood flow to the kidneys may decrease with age, affecting renal function and ability to regulate blood pressures and electrolyte balance. Increased risk of kidney stones. Changes in urinary composition function, combined with factors such as dehydration and reduced mobility, can increase the risk of the stone formation in the adults. Overall, the aging process can significantly impact the urinary system, leading to various changes in structure and function that may affect urinary continence, kidney function, and susceptible to urinary tract problems. To discuss how to take care of our urinary system, let's hear it from Ms. Sheila Espiritu.
Taking care of your urinary system involves adopting healthy habits. Here are some ways to take care of your urinary system. Stay hydrated. Drink plenty of water. Proper hydration helps flush out of toxin. Maintain balanced diet. Eat fruits, vegetables, limit consumption of processed and salty food. Practice good bathroom habits. Empty your bladder completely when you urinate. Practice proper hygiene. Keep genital clean to prevent the growth of bacteria. For women, wipe front to back to prevent spread of bacteria. Maintain a healthy weight through a regular exercise and balanced diet. Avoid smoking. Smoking can increase the risk of bladder cancer. Manage chronic condition. Diabetes and high blood pressure can risk of kidney disease. Practice safe sex. Exercise regularly. Physical activity to maintain overall health. Get regular checkups with your healthcare provider to monitor your urinary system health. By incorporating these habits into your lifestyle, you can maintain the health and function of urinary system and reduce the risk of urinary tract system.
To provide us with 20 medical terms related to the reproductive system, let's hear from Miss Princess Suma.
Hi, I am Princess Angelica Songa and I am from Sintagata Apalit, and I will be reporting 20 terms related to reproductive system. 20 medical terms related to reproductive system. First, testes.
Testes. A testis is part of anatomy of men and people assigned male at birth. Generally, you'll have two testicles. These body parts make sperm and hormones. Other names for testicles are male gonads or testes, pronounced testes. One testicle is called a testis.
Second, ovaries.
Ovaries. The ovaries are the female gonads. There are two, one of each entrance to the fallopian tube.
Third, uterus.
Uterus. The hollow, pear-shaped organ in woman's pelvis. The uterus is where a fetus unborn baby develops and grows, also called womb.
Fourth, penis.
Penis, the external reproductive organ of males. It is composed of mass of erectile tissue enclosed in three cylindrical fibrous compartments. Two of the three compartments, the corpus cavernosa, are placed side by side along the upper part of the organ.
5. Vagina.
vagina, the muscular canal that goes from the uterus to the outside of the body. During birth, the baby passes through the vagina, also called birth canal.
6. Prostate.
Prostate, a gland in the male reproductive system. The prostate surrounds the part of urethra, the tube that empties the bladder, just below the bladder, and produces a fluid that forms part of the semen.
7. Fallopian tube.
Fallopian tube recanalization is a therapeutic procedure performed to open an obstructed fallopian tube by passage of guide wire and catheter through a proximal fallopian tube obstruction.
8. Semen.
Semen, also known as seminal fluid, semen, fluid that is emitted from the male reproductive tract and that contains sperm cells which are capable fertilizing the female's eggs.
9. Ovulation. 10. Menstruation.
Menstruation. Menstruation is also known by the terms menses. Menstrual period, menstrual cycle or period. Menstrual blood, which is partly blood and partly tissue from the inside of your uterus. Flows from your uterus through your cervix and out of your body through your vagina.
11. Rectal dysfunction.
Erectile dysfunction, also known as impotence, is defined by difficulty in getting and keeping erection. It can be an embarrassing thing to talk about. It's been reported that more than half of men between the ages of 40 and 70 experience some form of ED.
12. Infertility.
Fertility is a disease of the male or female reproductive system, defined by the failure to achieve a pregnancy after 12 months or more, or regular unprotected sexual intercourse.
13. Endometriosis.
Endometriosis, a benign condition in which tissue that looks like endometrial tissue grows in abnormal places in the abdomen.
14. Cervix.
Cervix, the lower narrow end of the uterus or womb that connects the uterus to the vagina birth canal. The cervix allows fluid, such as menstrual blood, to pass from the uterus into the vagina.
15. Vasectomy. 16. Hysterectomy and gonorrhea. Then human papillovirus. And then breast cancer. And the last, epidemics.
Aging affect the reproductive system for male and female. Let's hear it from Miss Ina de los Santos.
Here are some aging process effects in males. 1. Testosterone levels decrease, impacting sexual function and sperm quality. 2. Prostate enlargement may occur leading to urinary symptoms. 3. Erectile dysfunction becomes more common. 4. Fertility decreases due to declining sperm quality. And here are some for females. 1. Menopause occurs, causing a decline in estrogen and progesterone levels. 2. Ovarian function declines, leading to the cessation of ovulation. 3. Vaginal dryness and atrophy may occur. 4. Changes in sexual function and libido can happen. Overall, aging affects reproductive hormones, fertility, and sexual functions in both males and females.
Again, I am Francesco Conanan and I will share with you how to take care of our reproductive system. To take care of your reproductive system, follow these steps. Number 1. Practice safe sex. Use condom to prevent sexually transmitted infection and unwanted pregnancy. Get regular screening. Schedule routine exams with the healthcare provider for STI testing, pap smears for women, and testicular exam for men. Maintain good hygiene. Keep the genital area clean and dry to prevent infections. Eat balanced diet. Consume a diet rich in fruits, vegetables, whole grains, and lean proteins to support reproductive health. Exercise regularly. Engage in a physical activity to maintain overall health and promote reproductive system function. Manage stress. High levels of stress can affect reproductive hormones and fertility. Practice stress-reducing techniques such as meditation, yoga, or deep breathing exercise. Limit alcohol and tobacco use. Consumption in smoking can impair reproductive function and increase the risk of infertility and reproductive cancers. Maintain a healthy weight. Obesity can affect hormone levels in fertility. Aim to achieve and maintain a healthy weight through diet and exercise. Get enough sleep. Adequate sleep is important for hormones regulation and overall health. Seek medical help for reproductive issues. If you have experienced any reproductive health concerns or symptoms such as irregular period, pain during intercourse, or difficulty conceiving, consult a healthcare providers for evaluation and treatment. By following these guidelines, you can support the health and function of your reproductive system. Closing statement. Studying the urinary and reproductive systems help caregivers understand how the body eliminates waste and manage reproduction. Knowing how this system change with age enable better support for older adults. This knowledge is vital for addressing reproductive health concerns and supporting individuals through family planning and pregnancy. With this understanding, caregivers can provide more effective care and improve the lives of those they help. Participation and designation. Our leader is Ms. Cheryl Tolentino, our editor and content researcher. I am Francesca Conanan, a secondary leader. I am a main host and reporter. Our member is Ms. Trisha Sagun, being reporter and visual researcher. Ms. Sheila Espiritu as our reporter and visual researcher. Ms. Ina de los Santos as our reporter and visual researchers too. And lastly, Ms. Princess Sunga as a researcher and supporter. Thank you everyone for watching.